All right, PARCA Clinical Section 3.4 covers planes of the body and positioning terminology. The human body can be divided by three geometric planes, namely sagittal, divides the body into right and left halves; coronal, divides the body into anterior and posterior, or front and back halves; and transverse, divides the body into upper and lower halves. It can also be divided into frontal, proximal, and distal. So proximal and distal. So if you look at your finger, down where the tip of the finger, where your nail is, that is the distal end of your finger, and back or by the knuckle where it connects to your hand would be the proximal portion of your finger. So distal, out near the end; proximal, close to where it starts. Other identifiers for image planes are axial, the axial or transverse plane; coronal, coronal plane; and dorsal, meaning your back; ventral, abdomen; palmar, anterior of the palm of your hand; volar, the back of your hand; plantar, sole of the foot; and dorsal, top of the foot. Now notice that PARCA uses dorsal for top of the foot and dorsal for your back. So you just have to figure out what dorsal means by the context of where it's used. Positioning terminology. AP is antero-posterior, front to back; posterior-anterior, back to front; lateral, on the side; lateral decubitus, lying down on the side. Upright position could be standing or sitting up. If you're sitting up, your chest is still in an upright position. Recumbent position, lying down. Left lateral recumbent would be lying down on the left side. Supine, patients lying on their back. Prone, patients lying on their stomach. Right anterior oblique. RAO is a right anterior oblique, so they would be lying on the right anterior surface of their abdomen. LAO, left anterior oblique, so they would be laying on the left anterior surface of their abdomen. RPO, right posterior oblique, they would be lying on the right posterior portion of their back. LPO, left posterior oblique. Lateral medial, starts at the lateral and moves towards the middle of the structure or the body. Mediolateral starts in the middle and moves out towards the lateral side of the body. Intra, within or inside. Extra, outside. Supra, above. Infra, below. Epi, on or upon. Sub, beneath. So don't get infra and sub confused. Infra is below a point. So if you say that, this is below the median level of the pelvis, it just means it's below a point. Sub means it's beneath a structure. So the kidneys sit beneath the adrenal glands. The adrenal glands are above, supra, to the kidney. So below means it's lower down and on a point. Some point is below another point. Whereas sub means it's actually beneath something. The gallbladder is sub to the liver. It's beneath the liver. So that's the difference between below and beneath. So thank you for watching.